This video will talk about death and dying. Specifically, we will cover what the definition of death is, what characterizes physical and social death, the leading causes of death in the world, as well as those in the United States, how COVID-19 has affected death rates, the current statistics on suicide and fatal drug overdoses, deaths of despair, where people die, and attitudes about death and death anxiety, and how they change as we age. I'll actually break this video up into two. So the second video will go into explaining the rest of these. I'll cover that later. So let's get started. So first off, how do we actually define death? That might seem a little strange, but nowadays with advanced medicine, we do need to actually define death. So the Uniform Determination of Death Act defines death as the irreversible cessation of circulatory and respiratory functions, meaning that your blood stops flowing and you stop breathing, or the irreversible cessation of all functions of the entire brain, including the brainstem. And they do note that brainstem as separate. If you recall, the brainstem, well, the cortex, the upper outer part of the brain, is responsible for a lot of our higher level thinking processes. Our brainstem is responsible for the most basic things about keeping us alive. So things like our breathing, our heart beating, body temperature, things like that. So they do separate that out, and that helps to also clarify things like a persistent vegetative state, where again you don't have that higher level brain function, but you still have the brainstem active. So the process of death, physical death, for individuals who are terminally ill, a series of physical changes occur leading up to death. In the weeks before passing, people will typically show little interest in food. Their sleeping increases, they're weaker, they need more assistance. They may also be restless or disoriented. In the days before death, individuals are less aware of their surroundings. There may be pauses in their breathing. Their blood pressure is low. They may murmur to themselves, may reach into the air or pick at their blankets. In the days to hours before death, there is a decrease in the level of consciousness, or you might enter a coma-like state, and have difficulty swallowing, longer pauses in breathing, and your breathing typically becomes more noisy due to the throat muscles relaxing. This is sometimes called a death rattle. Body temperature, blood pressure, and circulation to the limbs all decline, and so the hands and feet tend to feel very cool, and the skin changes to a dull grayish hue. Social death, on the other hand, tends to occur earlier than physical death, and it's when others begin to dehumanize and withdraw from someone who is terminally ill or has been diagnosed with a terminal illness. Withdrawal refers to not visiting, calling, engaging in small talk instead of deeper conversations. People withdraw because they don't know what to say, and they can't relieve the individual's suffering. They may also withdraw to help protect themselves from feeling the reality of death. And this, however, deprives an ill person from social interaction with others. Dehumanizing includes ignoring a terminal individual, talking as if they aren't there, making decisions without consulting them, and forcing unwanted procedures on them. It can provide a protective distance between a healthier person and an incapacitated, older, or unwell person. This helps to keep the healthier person from thinking of themselves as ill, and caregivers and medical professionals may do this to help protect themselves against grief, sadness, and possibly burnout. Most deaths are due to non-communicable diseases, things like heart disease, stroke, and chronic obstructive pulmonary disease, or COPD. In high-income countries, 70% of deaths occur in people 70 and older, and not less than 1% occurs in people under 15 years of age. Deaths in more high-income countries are usually due to chronic diseases, again, heart disease, stroke, things like that. While people in low-income countries, we see a much higher percentage of deaths in children under 15. So about 40% of deaths are kids under 15, and only 20% are people 70 or older. People are also more likely to die of infectious diseases like lower respiratory infections, HIV/AIDS, diarrheal diseases, malaria, and tuberculosis. The leading causes of death for newborns and infants in poorer countries are childbirth complications. So diving into the top 10 causes of death in the United States in 2020. Let's look at our history first. In 1900, infectious diseases were the most common causes of death, but now most are chronic diseases like heart disease, like cancer, as I mentioned. The COVID-19 pandemic actually brought an infectious disease back into the top 3 causes of death. As of July 4th, 2022, 6.34 million people have died from COVID-19 worldwide. And that has increased. I checked recently, it was 6.63 million. Europe has had 1.86 million deaths, Asia 1.45 million, South America 1.31 million, United States 1.02 million. And then places like Mexico had only 325,790 deaths, and Africa, the entire continent of Africa, had 255,120 deaths. So the actual death toll is thought to be closer to 14.9 million, and that is due to excess mortality. Excess mortality is calculated as the difference between the number of deaths that have occurred and the number that would be expected to occur in the absence of the pandemic, based on data from earlier years. It includes deaths directly due to COVID, as well as those indirectly due to COVID from its impact on healthcare and society. On May 17th, 2022, the United States officially reached 1 million COVID deaths, although the Johns Hopkins Center for Health Security believes it likely happened earlier due to flaws in data tracking and reporting systems. 75% of COVID deaths were people 65 and older. There were more deaths among men compared to women, and Black, Hispanic, Pacific Islander, and Native Americans had a disproportionate rate of deaths. While the United States' largest state, population-wise, like California, Texas, and Florida, had the largest number of deaths, when we examine deaths per 100,000 residents, so make it a ratio across the board, it's actually Mississippi, Arizona, and Oklahoma that had the highest death rates, while Hawaii and Vermont had the lowest. Not only did COVID-19 become a leading cause of death in 2020, but deaths from diabetes, Alzheimer's disease, Parkinson's disease, chronic liver disease, stroke, high blood pressure, kidney disease, influenza and pneumonia, and unintentional injuries all increased during this time. While COVID is not directly responsible for all of the increases in death, it is likely indirectly responsible for many of them, as ill people avoided going to the doctor for fear of catching COVID, didn't take care of themselves during lockdown, maybe lost their jobs, losing their health insurance, things like that. And that's what contributes to those that excess mortality, those other deaths. So using a meta-analysis of representative samples from several countries, the mortality risk for people infected with COVID is highest among late adults. And you can see here like for people aged 10, the death rate is very low in terms of risk. It's only 0.002%. For people who are 25, it's 0.01%. And it's not until you start getting to 65 and older where you start getting into 1.4, 4.6, at age 85, 15%. And if you're at 90 or older, it's 25%, quite high. And for even though some of these smaller numbers, they seem really small, like for example, age 25, that 0.01%. When we're talking about a global pandemic, uh, where uh, where we have millions of people getting sick, these numbers can become quite significant. So say if we had um, 1 million people, right, 1 million people who are 25 and they all get COVID, and only 0.1% of them die. What does that mean? So that means, so if we go 0.1, then we have how many zeros? 6 zeros for a million. So we just move that decimal point. 1, 2, 3, 4, 5, 6. Got a little messy there. So that ends up being 10,000 deaths for 1 million people at age 25. So again, once we start getting into talking about millions of people, even these very small percentages, like 0.1%, become 10,000 people, for example. So the risk, though, again, primarily for those in later middle adulthood and late adulthood, that's where we're really getting those very high mortality risk percentages. And that's partly due to older adults being more likely to have health conditions that make them more susceptible to illness, and because they're more likely to live in nursing homes, which, as we know, had many severe outbreaks. By April 2021, almost a quarter of US deaths were nursing home residents. As of January 30th, 2022, more than 201,000 long-term care facility residents and staff members had died from the pandemic. Sadly, it wasn't just the more transmissible Omicron variant, the amount of people coming into contact with one another, and the high-risk status of the patients, but also a problem with lax pandemic protocols. Although federal regulators issued fines to 3,400 nursing homes for violating COVID-19 protocols, watchdog groups still found that the protocols were too lax. So what about pre-COVID? Pre-COVID, top causes of death by age. Top causes of death definitely vary by age. During that first year of life, SIDS, sudden infant death syndrome, congenital problems, and other birth complications are the major causes of death. But after that first year, it becomes accidents or unintentional injuries as the leading cause of death throughout childhood and even into middle adulthood. And you can see here on this slide, top causes of death for ages 1 to 9 and for ages 10 to 24, unintentional injuries, over 30% for ages 1 to 9 and over 40% for those 10 to 24. So that's by far the biggest cause of death for people under 25. And then as we get into the older age groups, I mean, for 25 to 44, it's still unintentional injuries. But once we start getting into middle adulthood and late adulthood, cancer and heart disease and other medical conditions become those top causes of death. So you can see for ages 45 to 64, cancer, followed by heart disease, the major causes of death. For 65 and older and 85 and older, those switch for heart disease becoming the #1 cause and cancer taking second. If you're not including the other category. Suicide has increased 30% from the year 2000 to 2020. It has increased, although suicide is the 12th leading cause of death overall, it is the second leading cause of death for people between the ages of 10 to 34. And it's the fifth leading cause of death for people 35 to 54. Suicide rates are about twice as high in rural counties compared to urban counties, and almost 3 times as many men as women commit suicide. Males have higher suicide rates than females due to higher rates of substance use disorders, not seeking mental health treatment, and tending to use more lethal means. However, females are starting to narrow the gap in suicide rates. Among men, the highest risk age group is 75 and over. Among women, it is 45 to 64. Although the suicide rate has increased in America, it has decreased in Canada, Japan, China, Russia, United Kingdom, Germany, and most of Western Europe. America's suicide rate has been linked to deaths of despair, deaths that increase when economic and social well-being decrease. Rural communities seem to be especially hit by this, as they've lost many farming and manufacturing jobs, as well as having less access to mental health services. Other factors that contribute to suicide among those with and without mental health conditions include relationship problems, substance use disorders, financial or legal problems, and health concerns. So how do we prevent suicide? Globally, limiting access to lethal means has contributed to a decline in suicide rates, as in many other countries. And that has been due to things like using less toxic gases for heating, installing bridge barriers, and limiting access to firearms. Increasing the number and amount of access to prevention programs and mental health treatment, especially in the workplace, is another thing to consider. It's also important to know the warning signs and to encourage someone to get treatment. So some of those warning signs for suicide, if somebody expresses that they feel like they're a burden, if they're very isolated, if they have an increasing amount of anxiety, if they feel trapped, or if they're in unbearable pain, if they've increased their substance use, if they're looking for a way to access a lethal means of ending their life, if they're having an increase in anger or rage or extreme mood swings, if they express feeling very hopeless, if they're sleeping too little or too much, if they talk or post about wanting to die, and if they're making plans for a suicide attempt. Those are all clear warning signs of suicide, or maybe not clear, but potential warning signs of suicide. And it's important to take them seriously. Fatal drug overdoses have also been linked to deaths of despair, and fatal drug overdoses have been increasing since 1999, especially due to opioids. The rate of drug overdose deaths in the United States increased 31% just from 2019 to 2020. And you can see on the graph there, there's a pretty steep line going between the year 2019 to 2020, although you do see that increasing trend from all the way back to 1999. There has been an increase most of those years. So we've had quite a big increase recently, and that is among all race and ethnic groups. Males have higher rates of overdose deaths compared to females, but rates are similar in people living in urban and in rural areas, unlike with suicide where we saw a bit of difference there. Part of this increase in drug overdose deaths is due to synthetic opioids other than methadone, so things like fentanyl analogs, and tramadol. Deaths from these synthetics increased 56% from 2019 to 2020. Synthetic opioids are cheaper to make and easier to conceal than heroin, and that has really led to their growing use. So where do people tend to die? In the past, most deaths occurred at home, but in the United States today, about 60% take place in hospitals and another 20% in long-term care facilities. In the 1960s, a death awareness movement led to medical care in hospitals being better suited to the needs of dying people and also to hospice programs, which we'll talk about more later. 80% of Americans say that they would prefer to die at home if given the choice. However, only about 20% experience death at home. In order to make dying at home feasible, adequate support for the caregiver is essential. Hospital dying is affected by the physical state of the dying person, the hospital unit in which it takes place, and the goal and quality of care. Sudden deaths typically occur in emergency rooms where little time is available for contact with family members. In intensive care units, privacy and communication with the family are secondary to monitoring a patient's condition. Cancer patients, who account for most cases of prolonged dying, typically die in general or specialized cancer care units. Although hospital comprehensive treatment programs aimed at easing physical, emotional, and spiritual suffering at the end of life have increased, 1/3 of US hospitals still do not have them. Though deaths in nursing homes are common, care in nursing homes actually emphasizes rehabilitation rather than high quality terminal care. If we look at things internationally, about 54% of deaths occur in hospitals. The highest percentage rate is in Japan, where 78% of deaths occur, the lowest in China with 20%. So how do we perceive death and death anxiety throughout the lifespan? In infancy, we really lack understanding about death. However, infants do respond to separation, as we talked about with that separation anxiety when they are separated from a familiar caregiver. In early childhood, they again don't have a lot of understanding. They may think death is temporary or reversible, or they might have magical thinking about death, like maybe they could wish people back or that somehow they caused the death to occur. Moving into middle childhood, so the early elementary school years, that magical thinking may persist until the age of 9, but typically children are starting to understand the finality of death, so understanding that once you die, you stay dead. And many, and not many, some may think that they could have prevented a death. They may feel responsible or guilty about a death. Again, some of that magical thinking perhaps lingering, or just what if kind of thinking. And we see that in late childhood as well. So those later elementary school years where they understand that death is final as well as universal, that all living things die. They may still think that the person died because they did something wrong rather than, just everyone dies. They may start to fear things like their parents dying, and again, could experience guilt if a loved one dies. By the time we're teenagers, we understand death, fully. And some even kind of develop a bit of a fascination with death during the teen years. However, the personal fable often leads teens to feel a bit immune to death. So when they engage in risky behaviors, they don't necessarily think death will actually happen to them. I mean, they understand what death is, but more of something is something that happens to someone else. It's hard for them to accept that it could happen to them. In early adulthood, we typically don't think or worry about death, and that's due to low rates of death at that age, especially in higher income countries. In middle adulthood, this is where we experience the highest levels of death anxiety or fear about death. And that's often due to having a lot of caretaking responsibilities. Remember, many people in middle adulthood are part of what we call the sandwich generation, providing care to older individuals, their elderly parents, as well as care to the younger generation, their own children. And so they fear, they may fear their parents dying or themselves dying, and who will take on all of those caregiving responsibilities, who will take care of their children, who will take care of their parents if they were to die. In late adulthood, however, we actually have lower death anxiety, and this is thought to be due to having fewer caregiving responsibilities, having had more time to complete activities you may have wanted to accomplish during your life, and having had more experiences with death as family members and friends die. What late adults are most concerned about is control over how they will die, or at least some semblance of control. Of course, you know, we don't get all of the control typically over death, but having some say, having some control over something we have, you know, very little say over. And we'll get into next part next time. Thank you.